Hello, everyone. Uh, Hope you're having a good weekend. My name is Dr. Anand, and I'm a psychiatrist who works in the National Health Service in Yorkshire in UK. I would like to welcome you all for this interesting and wonderful event, which we have two speakers today, which I will introduce shortly. I'm a doctor who has always been interested in education. We started helping students, mainly year 12 and year 13 students, to get into medical uni for the last 5 to 6 years. We have tutored many who have successfully entered various medical schools in UK and some in Europe as well. And there has always been an interest for people to wanting to get into dentistry. And that's the reason why we are arranging this event for the first time today. And hopefully, with all your support, we'll continue to do so in future. We have two excellent speakers here today. Dr. Jaswinder Mataru, who is a very senior dental practitioner with more than 30 years of experience. He is from Leeds, but travels often to London for his business and work, as well as throughout the UK. He has advised and he has had large chain of dental practices and has advised many businesses on various aspects. I don't know whether there is such a word called dentapreneur. Probably it's time to coin one for Jazz especially. So he's a very interesting person, and he also has many hats, including being a magistrate on the West Yorkshire board. So we are all privileged to hear him speak for this event. And the other speaker we have is a young 21-year-old dental student, Sarthak Shetty, who is from Bradford and currently a year 4 dentistry student at Queen Mary's and Barts in London. So we have a mixture of experience and youth to talk to us and inspire you for a career in dentistry. So what we are going to do over the next 60 minutes is to give you some basic information about a career in dentistry in UK. To make it less chaotic, we only allow people to post questions on the chat box, but we'll be able to answer all your questions provided we manage to end it before 7:30. So with this, I welcome you all. Please, even as the speakers are doing the talk, post all your queries in the chat box so that we'll be able to answer that. Okay. So with that, I will hand over to Jess to give us your talk. Thank you.
Yeah. Thank you very much, Harold, for those kind words, and hi to everybody. Hopefully this is where your journey begins, I guess, for entry into dental school. I've been sort of tasked with the idea of condensing what is a 2-day residential training course into 20 or 30 minutes. So forgive me if I take the whole of this 30-minute discussion at some pace. I do apologize in advance. I'm joined by my very able and knowledgeable colleague, Sarthak Shetty, who's a 4th-year dental student from Queen Mary's College, I believe, in London. And he's also going to be able to shine even more light on the evening, as he's actually an active dental student, so to speak, at the cold face of the profession. And like Errol said, if you can refer your Q's and A's to the end of the session, and then if we have time, hopefully we'll be able to alleviate any queries that you may have. Very briefly, a little bit about me in context of dentistry. I qualified 33 years ago, and I bought my first practice almost immediately upon qualifying. I then became a CEO. I ran a large chain of dental practices. I didn't have any formal training in business or anything like that. I just had a desire to sort of pick and develop as practices as many as I could over a period of time. And we were fortunate enough to become one of the largest chains, certainly in West Yorkshire, before my group was acquired by what is now the largest chain in the country, My Dentist. And I also set up the Leeds Emergency Dental Clinic in the early 90s. I do other things. I do a little bit of property development. I consult particularly to new startups and my profession at large. Within my profession of dentistry, I also do some mediation. I was appointed as a founding member as the expert dentist to Lloyd's PLC Healthcare Forum in 2010. One thing that I'm very passionate about is mentoring dental students or prospective dental students like yourselves. And I run various courses over the summer to improve people's best chances of getting into university. I lecture to young entrepreneurs and young entrepreneurial dentists, and I consult to businesses nationwide. I think Errol alluded to the fact that also I've been a magistrate now for just over 20 years. I sit on the Lord Chancellor's recruitment panel, interviewing magistrates of the future, and I sit on the Crown Court. Very recently, I got appointed to the General Dental Council, and I sit on their appointments committee, the General Dental Council being the regulator of our profession. And very recently now, I've sort of jumped from dentistry into healthcare. We're just in the process of opening up a private healthcare clinic in North Leeds, along with a walk-in centre. That's enough about me. So about the audience, you, the audience, I guess there's going to be a range of students here, from those of you who have no relations, no siblings, no family members who have any contacts with the dental profession, to those whose perhaps parents might be medical professionals, dental professionals, or you might have siblings doing dentistry. So I'm really tasked with a broad brush approach to this, and 1 hour really isn't long enough. But the one thing that I will stress at the beginning and probably at the end is, please bear in mind, applying for dentistry is an incredibly competitive process. And what I want to do in 20 or 30 minutes is just get you into that mindset about thinking just how competitive it is and how we can get our best advantages to give us the best position to either get an application through or an offer, and hopefully an entry into one of the dental schools. I'll give you some statistics first, and it's quite alarming actually. For medicine, there are 45 med schools. There are 9,800 places, and there are 29,000 applications. That means that there's 3 applications to every med school place that's available. For dentistry, there are 16 dental schools, 1,128 places, and there were 100,240 applications last year. That's a ratio of 88 to 1. So it reiterates what I said earlier. It is very, very competitive. Most of the 16 universities, and I think my colleague Sartik is going to cover a little bit of this, have a mixture in terms of their entry interviews by way of either a traditional format interview, of which I think Bristol, I think Queen Mary's where Sartik is, Dundee, Newcastle and Sheffield have traditional based interviews. Perhaps Liverpool does as well, I'm not sure. But I think the majority now have moved on to what is called the MMI format, the multiple mini interview format. But I want to talk a little bit about dentistry, first of all, from a wide lens. And I'm going to cover 6 or 7 things. And I'm going to pace through them a little bit because I am unfortunately quite conscious of the time. But the things I want to cover, and there will be some overlap with what Sartik discusses later, is I want to talk a little bit about dentistry and what types of dentistry there are. I'll touch on aspects of what the NHS and private sectors is. And then importantly for you, some strategic planning advice for applying to university. We will touch on how really to complete and optimize your personal statements. We'll then move on to maybe interviews and what the MMI format is. If I have the opportunity, I do want to talk a little bit about ethics. It's one of the underpins, I think, on the selection process. So I think talking a little bit about ethics is very important. And finally, I'll just touch on the General Dental Council and what its regulatory responsibilities are and how that's important to you as a dental student. So let me start. I usually ask when I'm preparing students for interviews, I usually ask them a really simple question for which, unfortunately, I tend to get a very poor answer. And that is, what is dentistry? And it's the same question I'll ask medics as well. And actually, it's quite a difficult question to answer. Whilst we all think we know what it is, there is a definition to dentistry, as there is a definition to medicine. And I think if you're looking to study dentistry, it's quite important to understand what it is. Dentistry, in my view, is the science that's concerned with diagnosing, with preventing, and with treating the diseases within the teeth, the gums, and all of the related structures in and around the mouth, which includes sort of replacement of defective teeth. And what dentistry does is it has various branches within it, and primary responsibilities of dentists like us or dental students are going to include the following, and it's important to be familiar with these. One of the things that we're responsible for is preventative care. It's up to us to advise our patients and the population about good oral health, about practices such as regular brushing and flossing, and just really giving them good advice on diet and how to prevent dental problems. One of the other responsibilities we have as a dentist is to diagnose. We're there, problem solving. When people come in with problems, we use our diagnostic tools. We use x-rays, we use the visual examinations, and we have other imaging techniques to identify what dental problems there may be. And there can be a wide range from somebody having a dry mouth to having decayed teeth, right the way through to somebody presenting themselves even with types of oral cancer. So that's one of the remits that we have and responsibilities. Like every dentist, and you'll be familiar with this, we treat patients. So we perform a wide range of treatments that vary from extractions to fillings to root canals to orthodontic treatment, and more specialized things like providing crowns for patients and bridges and implants and carrying out quite extensive surgery. So that's one of the responsibilities. The rage now, I think partly due to social media, is that there's a new responsibility of sort of delivering cosmetic dentistry. And that's really treatment that's there to improve the aesthetics and the appearances for our patients. It's caught a lot of traction over the 10, 15 years. And there are actually practices now that are just entirely dedicated to cosmetic dentistry. Other aspects of our responsibilities are to carry out things like oral surgery, where we extract teeth, either simple, straightforward extractions or slightly more advanced surgical procedures like impacted wisdom teeth or carrying out dental implant surgery and placement. One of the fundamental responsibilities also is we're oral health educators. So it's our responsibility to educate our patients and an audience at large about things that can keep their teeth, gums, and oral cavities healthy and how to prevent dental diseases. And finally, something that's been dear to my heart over the 30 years is emergency dental care. We enter this profession to care for people. And one of the fundamental tenets of caring for people is being there for them in their hour of need. And so we as dentists are there really to provide emergency dental treatment to our patients, either through dental injuries that they might have, severe toothaches and or infections. So that's a little bit about the remit of, I guess, what dentistry is and what it involves. The second thing I want to talk about is a combination of understanding NHS and the private sector within dentistry. Just to give you a little bit of a contextual history, the NHS was set up in 1948, and dentistry has always been a part of NHS delivery of healthcare services. It's heavily subsidized by the government. So whilst patients might come into the dental surgery and have treatment done, they may feel that they're actually paying for their treatment. In actual fact, they're making a contribution, but it is still subsidized by the government. And for those of you who might be making notes, at present, the NHS delivery of service model for dentists is a 3-band system. There is a band 1 where we examine patients and do diagnostics, take x-rays, etc. If that patient requires any fillings or any number of fillings, actually, or extractions, then it falls into a band 2 category. And if there's any advanced work required on a patient, such as crowns, bridges, dentures, anything that it requires lab work, that then falls into a band 3 category. And all of this funding is made available within the NHS format of delivery. It saddens me to say it's meant to be intended and to be accessible for all. But I think if you've read the press recently, and I think for prospective dental students, it's important to be aware of the challenges that the profession is facing. The reality is, at this moment in time, it isn't accessible for all. And I think that's partly because we have a real skills shortage and crisis in our profession. And unfortunately, that's a socio-political exercise, not down to the dentists who, I guess, within the NHS are delivering, the best service that they can. So there are challenges to NHS dentistry, and that is around access to patients seeing dentists and access to patients having dental treatment done on an emergency basis. And you might have read in the press, there are cases where people have travelled 200 miles to see a dentist, or more extremely, reports of patients who have extracted their own teeth, and that's been quite prevalent in the press quite recently. And just while we're on the NHS, and I think Asartik may touch on this as well, it's important for any of the year 12 or certainly year 13 students to be familiar with what the guiding principles of the NHS are. Things such as, I guess, working together for patients. Patients must be center stage of everything that you do. Everything must be patient-centric in terms of NHS delivery of care. What we must do is respect and carry out our services with respect and with dignity. We must commit to quality of care, and that's done by way of internal audits. We have peer reviews. We have a lifelong commitment to continued professional development. We must demonstrate compassion towards our patients and our fellow colleagues. Ultimately, we're there to improving the lives of our patients. And probably one of the most important things, I think, is that the NHS, one of the undermining guiding principles is that everybody counts. You must see patients in an NHS or a private environment, for that matter, without fear or favour, irrespective of their background, their creed, their sex, their orientation. We must treat all patients equally. So hopefully that covers a little bit about the NHS and its tenets. I want to talk a little bit about the types of practices there are. So within dentistry, we have the NHS model, which we've just spoken about. And these are just practices that provide dentistry for a fixed amount per annum, delivering X amount of dentistry. In more recent years, particularly post-COVID, we've seen the inception now of private dental practices. And I think they now cater for about 30% of all practices in the country. And I think there's a demand, with access being such a problem within the NHS. I think entrepreneurial dentists have seized on the opportunity of sort of opening up their own private practices. You will see practices that are mixed dental practices, and they have an element of NHS and private dentistry within their organisation. What we're seeing more and more now of are specialist dental practices, practices that just carry out endodontics, or just carry out orthodontics, or periodontics, or do oral surgery, and that's becoming quite common now as well. As I said earlier, there's certainly a shift now towards established centric cosmetic dental practices that just engage with patients purely on a cosmetic and aesthetic improving service. And they're gaining quite a lot of traction as well. One thing that we see less of, but they're still prevalent, and I have a particular interest in them, are the emergency dental clinics. And you tend to find there's 2 or 3 in each major city, and they can either be funded by the NHS or private. Touching on another aspect of dental services, we have community dental services, which again are contract bound by the NHS, and they tend to specialise in seeing patients that are children, perhaps under 18, the elderly, or individuals who have special needs. What you're now seeing in the dental sector as a whole are large corporate dental chains opening up. And finally, probably your first experience of dentistry will be within the university dental clinics, and they're clinics that see patients for the purposes of teaching within a university setting. So I think that's a remit, a sort of a broad spectrum idea of the types of practices that we have. So the third thing now I want to move on to is strategic planning. And this is where I think all of you now will probably be focusing your efforts, particularly if you're year 13. It's trying to plan which universities you want to apply for and how to justify where you're going to apply. So there are some metrics you can apply to this. But I guess fundamentally, it's going to boil to a number of factors. It may be based purely on geography. You may be one of those candidates who says, don't care where I live, I want to spend 5 years in London, so therefore I want to apply to one of the London universities. And that's fine. So that's part of your strategic plan. I guess what's equally important is whatever you think your predicted grades are, because if you are not predicted to get the very highest grades, I think there's a lot of data out there on the internet that that sort of informs you that some universities may not even offer less than 2 A stars and an A. So you can strategically plan according to what you think your predicted grades may be. For those of you who are going to be sitting your UCATs very shortly, if you haven't already done so, I think that score is going to be quite important to some extent in deciding which university you're going to apply to. I think an average score, Sartik, you probably will be able to advise better on this. I think an average score might be 2,500, and a good score is regarded as maybe 2,750. I think might throw you into the 80th percentile. But again, I think I'll refer back to Sartik, who's probably the expert in that at the moment. I think other things that you want to bear in mind is research whether the universities are doing a problem-based learning course or whether it's a traditional type of course. There's 2 very different formats. So I think it's important you realize what format the university has that you wish to apply for. Another consideration might be how near or perhaps how far from home you want to be when you're applying to university. And I guess last but by no means least, I think it's important to sort of categorize which ones perhaps are the easiest ones to get into, either as your sort of backstop entry position, or perhaps if you feel you're not a high academic achiever, then maybe you can consider applying to those universities, because really it's a numbers game. So you've got to bear that in mind. So in summary, what I would say is research the dental schools, make sure that the A-levels you're doing are accepted for that university. I mean, I have a colleague of mine who applied for medicine last year, and he didn't do biology and realized that there's a lot of universities, particularly in London, that don't accept and don't offer if you haven't done A-level biology. So make sure that the A-levels that you are doing are acceptable by the universities that you wish to apply for. You've obviously got to do your academic preparation. You've got to prepare hard for the exams. Make sure that in your own mind you're able and able to achieve the grades. I'll talk a little bit about work experience, but I think we might cover it in a little bit more detail later on. Up to COVID 2020-21, it was very, very relevant for your work university application to demonstrate relevant work experience between 2 to 4 weeks. But I think generally now, having spoken to many universities over the last year or so, I think it's generally recognized now that most universities, post-COVID students, they've struggled to gain the relevant work experience. So I think there's a general understanding that you will not be disadvantaged in any way if you've not managed to secure the work experience. We'll talk a little bit about UCAT later on. Touching on personal statements, and I'm going to come back to it a little bit later. It's really important that you write a compelling personal statement that highlights your passion for dentistry and your experiences and your personal reasons for pursuing the career, and tailor make it to fit you. It's very easy to put a generic personal statement in, but actually they want to know about you and what differentiates you from everybody else. I'm going to go on and talk a little bit about interviews later on. One thing I want to touch on now as well is please make sure you have a backup plan. Understand that applying to dental schools is highly competitive. There'll be a lot of disappointment for many of you, unfortunately. It is a statistical game, but have plan B in place, either by way of an insurance application, or there is opportunities now to study abroad, Prague, Valencia, some of the universities that have General Dental Council accredited courses. And even though we've now left the EU, there was an announcement made recently at the General Dental Council that they are still accepting students who come back for the next 5 years. Anybody who was qualified from Europe will still have a soft registration with the General Dental Council, and you won't have to sit international exams. Last, I think it's important to stay informed with the profession. Try to keep up to date with whatever the latest information and developments are, because if you do get asked a question, particularly on a panel interview, they may ask you to discuss something that's in vogue or in the news with regards healthcare. Certainly during COVID, a very popular question for dentists was, let's discuss something about cross-infection in the dental surgery. So just read a little bit. You know, there are some dental journals that you can subscribe to. So try to keep up with what the modern trends are. And I guess finally, if you get to the interview stage, you have to be able to interview well. And again, I'm going to talk a little bit about that in just 5 minutes or so. So let's follow this through. Let's talk a little bit about personal statements. I think it's really important to have a structure to your personal statement, and the narrative has to be compelling and personal to you. Start, I would say, with a very engaging opening statement that really grabs the reader. It can be anecdotal, it could be a quote, or it could be just something that you think is relevant to you. I had a student I mentored a few years ago, and after some discussions, he said to me, my grandmother died of oral cancer a few years ago. Now, to me, that was a fantastic, very poignant, very relevant, and very personal start to his statement. So think carefully about how you want to engage with the reader. And in that first 1 or 2 lines, it's important to sort of set your stall out and differentiate yourself from all the other applications. I think it's important in a personal statement that you're able to describe and explain your personal motivations for dentistry. And if you can, highlight your passion for helping people. Dentistry is a subsection of healthcare, but actually try to demonstrate how you care for people. And one of the things I think that's really important now is voluntary work. I think that's become one of the factors I think that a lot of assessors are looking at is what sort of contributions are you making to your local communities? So think about that. The other thing is really covering your academic and your extracurricular achievements. And that's, you know, it's pretty standard. Talk about your achievements, state them, keep them concise, and keep them related to dentistry if you can. You want to highlight your personal quality skills. And the one thing that I say, and I've spoken to a few candidates who are on this course today, if you're going to evidence any of your personal qualities like empathy or communication or attention to detail or manual dexterity, what you must do is evidence the skill. So, for example, it's not good enough to say, I'm a good listener. What you want to say is, I'm a good listener. I counsel lower year groups who have difficulty in school, so they come to me with their problems. So if you're demonstrating a skill, it's really important to try evidencing it, and put in as many of your relevant experiences as you can. It's okay, I guess, to put in personal statements, things that have challenged you over the years, because some things that certainly the MMIs like to pick up on, or it's okay. Interviewers appreciate candidates who can demonstrate resilience, and the ability to learn from setbacks and mistakes. So in some ways, you have to own that and demonstrate that there's a human side to you. And I think, if anything, that sort of adheres you to any potential assessor. But in conclusion, what you should really be doing is summarizing your passion for dentistry and all of your qualifications. From what I believe, I think it's 4,000 characters. So, and it's very, very important that you remain within that 4,000 maximum. I'm going to talk a little bit about interviews and MMIs. I'm just going to have a quick check on the time, because what I don't want to do is take up any more time than I have to. It doesn't really matter what course you're applying to, whether it's medicine, dentistry, law. The secret of interviewing is the same, and I'll touch on some of those fundamental blocks now. I've noticed over the years that some very intelligent people actually interview quite poorly, and some average candidates can interview really, really well. And one thing I would put it down to is it's in the preparation. So just like when you sat your GCSEs, or if you're doing your A-levels, whether you play competitive sports, for those of you who are preparing for UCAT, piano grading, anything, you don't just turn up on the day. You practice, and you practice. And that's what gives you the best chance of success, is by constantly repeating, and that gives you the competitive edge. Why do we interview? I think it might sound quite straightforward, but let me just tell you a little bit about what interviewers are looking for, so it puts an interview into context. It's a very competitive discussion for universities to pick their very best students. So you have to prepare and go into it as though you're entering a competition. So if you play netball or football, you don't just turn up to a really important match. You prepare pre-season, prepare yourself mentally, physically, psychologically for the big day. If you leave it till the last minute, you've probably left it too late. I've interviewed now for nearly sort of 30 years in my profession, and there's a couple of things I'm just going to give you as pointers, so it allows you to understand what interviews looking for. I'll ask you a question. How long do you think it takes for an interviewer to decide on whether to select a candidate? And this evidence is from the retail industry, not necessarily specific to dentistry. A third of interviewers, 33%, decide in 90 seconds whether to hire you or not. So in 90 seconds, they make a conscious, subconscious decision. So it's really important you don't get that second chance to make your first impression. You have to make that first impression first. A lot of it depends on the way you dress and the way that you act and the way that you walk through the door, your swagger, and a proportion of it is your voice and grammar. But what's really important is the art of communication. And that's something that we all are constantly trying to strive to improve. The things when it comes to good communication, positive handshakes, body posture is really, really important. If you're sitting in an interview, or even if you sat online, have your back straight, no slouching. If you are slouching, it can look as though you're a little bit disengaged. But the most important thing in an interview is to constantly maintain eye contact. And that allows you to engage with the interviewer all the time. And it's probably one of the hardest skills to adopt, but you have to constantly work on it. So I talk a lot about communication when I do my interview preparation seminars, and it is very, very important. There are many ways of communication: by body language, by your visual, your written words, and the spoken words. But I would summarize communication as follows, if you're fortunate enough to have an interview or an MMI. Introduce yourselves with authority. State your opinions with authority. Be confident in what you say and don't ever be afraid to share your thoughts. Remember, it's not just what you say, but it's how you say it. When you do get a question, take time to consider both sides of a scenario, and approach a question with the answer from the outskirts and then drill down into more detail. Important to pay attention to the whole question. Sometimes a question can be split into two parts. So it's really important that you concentrate on all the aspects of the question. But generally speaking, the MMI interviews are there to assess your teamwork, communication, your self-awareness, maturity, empathy, and critical thinking. One last word on communication. Lord Neuberger, the president of the Supreme Court, probably one of the best legal minds in this country, said very famously that if you want to communicate, just communicate in a language people can understand. So the best advice I can give you is when you're talking or being interviewed, don't overthink things, don't over-articulate. And the best advice is just keep things simple and keep things clear. I'd like to talk a little bit about multiple mini interviews, but hopefully Sartik will cover that. Suffice to say that I guess the things that they're trying to assess are your communication skills. There will be ethical dilemmas. There'll be problem solving, demonstrations of manual dexterity, how you work in a team and collaborate. There's almost certainly going to be some knowledge of ethics, of perhaps of time management, and how you converse and communicate with diverse populations. There may be a question on stress management, how you deal with that, and possibly how you might do a simple assessment on patients. And most of these are usually either scenario-based, you'll have the ethical dilemmas, there might even be a role-playing scenario in there. If I'm okay with time, just a couple of minutes about ethics. It's really, really important in dentistry. And dental ethics basically encompasses a range of principles and guidelines that guide your behavior in decision-making of dentists and dental professionals. And it covers things like patient autonomy, making sure that the patient ultimately decides what they want to do after they've been given informed information. Beneficence, only do what's good for the patient. Non-maleficence, don't do any harm. Justice, be fair and be equitable. Veracity, always be honest and truthful. Respect patients' confidentiality. We will talk a little bit about informed consent. Be committed to education and integrity. Just for those of you who want to delve a little bit more into ethics, there's fundamentally two types. You have utilitarianism, which says that it's acceptable, say, for example, to force, cajole, threaten, or even entice people or pay them to have a vaccine. And that's a dilemma that the government faced a few years ago. And so really, that's utilitarianism is a society-centered, whereas deontological is really an ethical approach where it's based entirely around what the patient is and what's in the best interest of the patient. I'm going to finish by one last point, and that's just to touch on the General Dental Council, which is our regulating body. So the GDC is our regulating body, but one thing I think what you would be expected to know as candidates are what are the principles that we as professionals should follow. And there are 9, and I think Sartik may well cover them as well. But it's fundamentally putting patients first, communicating well with patients, making sure that we obtain valid consent, or protect patients' information, have a clear and effective complaints procedures, or work with colleagues in patients' best interests, develop professional knowledges and skills together, raise concerns if we have for patients and staff at risk, and make sure that our personal behaviour maintains confidence in the dental profession. And they're similar to what we call Nolan principles for people who work in public office, things like being selfless, open, being objective, being honest, being accountable, demonstrating integrity and leadership. So I think that concludes my chat, certainly for this evening. I do apologize for the information overload. But if there's one thing I would say is just be the best that you can be. And in order for you to do that, please prepare well, and good luck. So thank you very much for listening. I'll pass you back to Errol. Thank you, Errol.
Okay, thank you, Chas. That was highly motivational and interesting talk, especially coming from a much experienced person like you. I understand you do intense weekend training for dental students as well.
Yeah.
And all your statistics are very valid. And thanks for all the practical tips, which I'm sure people will find it helpful. So I hope there will be time for you to come back to answer any queries or maybe give you a finishing touches after Sarthak's brief talk. Now I invite Sarthak to come and share your view as a dental student briefly. Thank you.
Yeah, thank you, Dr. Jas. Thank you, Dr. Elliot. I'll just share my PowerPoint now. It's quite brief, so don't worry about that. Okay, yeah. So a lot of the stuff that I'm going to cover now will have already been covered by Dr. Jas, but yeah, I'll just reiterate like the more important points. So my name's Sarthak Shetty. I'm Sorry, I think I just got muted there. But yeah. My name's Sarthak Shetty. I'm a fourth year dental student and I attend Barcelona London School of Medicine and Dentistry of Queen Mary University of London. Yeah, so the agenda for this brief presentation is wanting to pick the right dental school for you. So like here I've got a little image of the different dental schools available in the UK. So again, compared to other courses, there's very few dental schools as opposed to like if you want to do maths or something. So again, I want to reiterate how competitive it is, but don't be afraid. Like just if you think this is right for you, then just put your all into it and hopefully you'll get in. Yeah. And then I want to go through the requirements again, the personal statement and the interviews just to reiterate. So some important websites that I think you should know by now, like one is UCAS. So you're probably familiar with this. So this is where you'll have access to all the different courses available, all the different universities. So in terms of your requirements and in terms of what the different universities can provide, this is an excellent place to start. So just drop in dentistry and see what unis are available. Just have a quick read of everything and it'll also provide you the requirements. And another website is the Complete University Guide. So this one provides like league tables and it shows right now what's ranking as the best dental school. I'll warn you, like with this, it varies between years, so it's not the best thing to go off of. It's just like a brief understanding of where it's ranking. So you could use this as to see what you'd put as your first choice and what you'd put lower down. So obviously you will have 4 choices of dental school and you can put a 5th choice, which is non-dentistry based. But then, yeah, you can use this table just to give you a brief understanding, but obviously don't rely on it too much. More importantly is university open days, like try to get in on them early. So obviously, if you're in year 13 right now, then I'd very much recommend like trying to get into open days as soon as possible. So I had a look yesterday. I think they might have already started, or even in October, like early October, they're going to start their open days. So just get in, see what the uni's like, see if it's right for you. And then, yeah, so in terms of requirements, there's obviously your GCSE. So you might have obviously forgotten about them by now, but these will come back. Like, again, this is an example for Queen Mary, what the requirements are. So for A-level, it's A-star AA. The majority, I believe, is still 3 A's, but then Queen Mary and King's look for A-star AA. But then for GCSEs, you click on the drop-down menu, you'll see the different requirements. So some, for example, like even for like English language, most unis are fine with like 6s, but then there are some unis and just, so if you did get a 6 and not a 7, just have a look at this, because some unis like throw in there 6 is acceptable, but they will focus on students who have 7 or above. So if you don't have that, then maybe look for a different dental school. again, like Dr. Jazz said, it is a numbers game. Just go with whatever gives you the best chance of getting in. And then, yeah, so here we go, work experience. So again, like Dr. Jazz said, this has been quite difficult for students to get work experience since COVID time and everything. But obviously, it'll put you ahead if you can manage to secure some work experience. If you got any contacts, even if you have like a good relationship with your local dentist, like see if you can do some shadowing, see if you can like have a look around. Like it's just a really good thing you can put into your personal statement and something you can bring up in interviews. Like me personally, I'm lucky that my brother's a dentist as well, so he helped me out. He helped me out a lot of getting work experience. But then when I also went to India, I have a few cousins there who work in hospital and stuff. So I even use those contacts to try and get work experience abroad. And just things like that can put you ahead, like can make you stand out a little bit if you can bring that around. And then, yeah, so your personal statement. So this, the deadline for this is usually around mid-October. So obviously, if you're year 13 now, then you'll probably be close to submitting this. If you're in year 12, then I'd say with personal statements, it's good to start early. Like, even if it's just a brief draft, just an introduction, just throwing some ideas down, just start it early, and it'll be a lot easier as you go along. Then obviously another important requirement is your UCAT exam. So before, they also used to be a BMAT exam for certain universities. So I believe Leeds used to require BMAT, but then I think that's changed. So for 2024 onwards, entry, all universities require UCAT. So yeah, this is a very important part as well. So it consists of verbal reasoning, decision making, quantitative reasoning, abstract reasoning, and situational judgment. What I can say about this is it's just another like stepping stone to get to dentistry. The reason that they put UCAT in is just to, it's almost like just thinning the herd, to be honest, because again, dentistry is very competitive. A lot of people want to do it, and there's very little places. So they just put these extra steps in. They put in the UCAT, they put in interviews just to almost stray away people who are less like interested and less focused into getting into. So just with UCAT, again, start early. Like, so I've got two books down here, just pictures. So the one on the left is the one I used. It's from 2017, 1250 questions. But then obviously there's a newer one, 1,300 UCAT questions. So that's from 2021. I definitely recommend getting this book. Like, just get it on Amazon, or even just get it from eBay if it's like a used one. Just go through the questions in your spare time. Just practice. Like with the UCAT specifically, it's not that the questions are like extremely difficult, not usually. It's more about the time constraint. Like there's a lot of questions in very little time that you have to answer. So if you just practice, just do as many as you can, especially with like abstract reasoning. Like this will be very different to any other questions you've done before. Like it's all like shape based, and yeah, it's like abstract thinking. So when you start this, you might be a little scared, a little put off because you just don't understand it. But the more you do it, the more you understand the patterns in the questions, it'll become easier as you go. And then obviously closer to the time, just start doing some practice papers online. Like if you go to the UCAT website, they provide some practice papers. Just get through them. It'll just familiarize yourself for the real exam. And then yeah, so exams for UCAT are between July and September. So if you're year 13, then you might have already done this, or it actually ends in about 4 days. So yeah. So yeah, interviews. If you get an invite for an interview, that'll be between November to March, depending on the university. And then obviously your annual requirements. It's usually 3 years, but then for some, it's A star A or more. So yeah, just reiterating about personal statements. So Dr. Jas already said, like, it's very important that you don't want a very like default personal statement. It's all about you. Like they want to know about you. So just a brief like structure that I've just put here is an introduction, a little bit about your volunteering or work experience, academia. So this is like the subjects that have interested you, like what you like about that. But I've said keep it brief because everyone applying to dentistry, like you're all intelligent. If you're here, then you're obviously an intelligent student. They know that you're smart. So just keep that bit brief. Like everything that you want to talk about in your personal statement, you need to link back to dentistry. Like obviously, if you're interested in science, that just links to dentistry. But then here, like hobbies and achievements. So if you play football, put it in. If you do music, put that in. Like just link everything to dentistry. Like for me, I played the piano and trumpet, and you just link it hand-eye coordination. Like yeah, obviously dentistry is very hands-on, so stuff like that that you can link just to it. And then achievements, if you've done Duke of Edinburgh Award, that's all great because obviously volunteering is a part of the Duke of Edinburgh Award. So if you just talk about that as well, and then if you get your work experience, just talk about that too. And I've written here that they want a student. Like a lot of people think that unis want a dentist to come in, a dentist to join. They want students that will become dentists. So they want someone who has other interests, other hobbies and stuff. When you join the uni, they want someone who will contribute to the uni. So joining societies, even doing extra volunteering, like stuff like that. Like they want a student. And yeah, obviously your conclusion at the end. So yeah, interviews. So yeah, there's two types of interviews that are available right now, depending on the uni. So that's MMI and panel interview. So the majority of unis have moved on to MMI, which is your different stations. Dr. Jas mentioned it. So yeah, in terms of this, like MMIs can be quite tricky in that they're very fast paced. Like once you start a station, you'll be out of it before you realize. Like, and what I can say about this is if you think you've tripped up on a station, just forget about that station, focus on your next one. Like when you get into dental school or medical school, like you do OSCEs, and this is the same type of transferable skill that they're looking for, that you can just get through different scenarios. So you can have in both interviews, you can have very abstract questions. Like, for example, an interview question that I got that was very strange, I thought, was if you're stranded on a deserted island, what three things would you bring with you? And questions like this, it's just more seeing your communication skills, your thinking. So there's not necessarily a correct answer. It's just as long as you bring an answer and you justify it. But that's the type of thing they're looking for. And yeah, like I had a question where it was if you have to cut the funding for three different charities that they said, which one would you cut? And again, it's like a very strange question. Like there's almost not a right answer, but again, it's just the communication skills. But then again, there can be very specific questions to dental knowledge and to ethics, like Dr. Jas said. So for example, in one of the MMI interviews, I had three different pictures of like dental images of like a filling, of a denture, and then they just ask you like, what's this, what's that? Like, so just having some basic dental knowledge will help you along the way. And again, just have a brief look at the GDC principles, which I've put here. So there's 9 principles. Put patients' interest first. Like these are like very important to being a dentist. So they'll want you to have some knowledge on this. And there's NHS standards as well. I haven't put that here, but you can just go look at that. It's just they want someone who will put their patient's interest first. Like obviously, and a big question that you will most likely get asked is why dentistry? Why did you choose to do dentistry? Why didn't you choose to do this? Obviously, like don't say you did it for money. Like that's obviously a great thing on the side, but obviously they don't want that answer. They want someone who will be a good dentist. Like why you like being hands-on, you like communicating, and you want to communicate with patients. You want to make patients' lives better. Like for me, in my personal statement, I put about how I had orthodontic treatment in the past and how this influenced me. So like little things that might influence your decision to do dentistry can help a long way. So just think about that as well. And then, so I put here like why that university. So the thing about this is sometimes the universities are known for specific things. So like with Queen Mary, it's very specific, but like with Queen Mary, it's in Whitechapel, and that the Whitechapel area is known for like a big Bangladeshi community, and there's been high prevalence of oral cancer here. So there's been a lot of cancer research. If you can just find out like small things about the university that you could bring, then that could set you ahead as well. So just research the universities. Obviously, you'll be doing that because you'll know if you want that to go to that university or not. And yeah, just look for it. And again, I said they want a student. So if you got hobbies and they ask you about it, just talk about it. say how you'd be likely to join the societies. And again, like you can even see if there's not a society, you'd start a society. They want someone who will contribute to the university. If you like volunteering, you can bring that about as well. And yeah, so that's just a little brief overview. I'll pass it back to Dr. Elil. Thank you for listening.
Okay, thank you, Sarthak. That was practical tips. Thank you. Final words from Jas. Just you got a couple of minutes to say, any final important points before we finish off.
Yeah, I mean, I think Sartik also alluded to the same thing, really. I think we must realize if we're applying for dentistry, it is an incredibly competitive career to apply and get entry to. So if you are year 12, you've got a little bit more time to prepare. If you're year 13, it's really, really important we get your head down and rehearse. If you're fortunate to get an MMI or a panel interview, revise, practice, whether it's with your friends, family, just learn the art of being comfortable in conversation. It's easier said than done, but I think if you leave it till the last day to have a live interview, I honestly think you might have left it too late. So practice maybe half a dozen times at least. You can get all the questions or similar type questions on the internet, and just ask somebody to pose those questions to you and see how you respond. And part of the trick is to really expand out. If you have 4 or 5 minutes, to use all the 4 or 5 minutes, show them the best skills that you have.
Okay, thank you very much. Yes, that was a very valid point. Practice. They say practice makes a man perfect. So I think, especially in terms of examination, within the given time, you should be able to, produce what, it doesn't matter what you know, what you actually exhibit on that day is, and the only way is practice. And that's what we plan to do after this is we can offer MMI interview training. And also, if you need any one-to-one training, do contact us. Finally, hand over to Priya, who is our admin. And if you have any queries, please liaise with her. Over to you, Priya.
Thank you, Dr. Anand. Hi, everyone. My name is Priya. I'm the Operations Manager for Educate the World. I want to thank the speakers, Dr. Jasvinder Matharu and Sarthik Shetty, for taking the time out of their busy schedule to talk in today's session. I hope you all found today's session helpful and informative. If you have any queries, you can get in contact with myself on 07958 913329. So that's 07958 913329. And I wish you all the best for your future endeavors. Have a nice evening.